Hello everybody! Magandang gabi po sa inyong lahat. This is Ria Luz of Buhay Buhay sa Amerika, right at home, and I'm so grateful. We have a wonderful panel with us on this topic, impact of pandemic on mental health. And look who we got, the best of Arizona's finest. In fact, we have our amazing psychiatrists and our very, very respectable Dr. James Campbell with us as our guest speaker. And we got Ate Marietta Stites, who was much responsible for getting Dr. Campbell to join us. And of course, my favorite queen, Dr. Ria Flores Tamayo as well.
Hello.
Our audience.
Good evening, Dr. Campbell.
Yes, Dr. Campbell, before you speak, because I know everybody wants to hear and know. We know who is Dr. Campbell, but for our audience, Dr. Campbell, we wanted to recognize this amazing Filipino. Since we are actually celebrating the Filipino American History Month, and also we are reminded about the fans, which is Filipino American National Historical Society, who are represented here, Ate Marietta and Dr. James Campbell, and my Dr. Ria Flores Tamayo is one of our founding members of the Committee of Buhay Buhay sa Amerika, and my tokayo. Do you know what accomplishment Dr. James Campbell got?
I would like to know that.
Yes, since it is Filipino American History Month, there is no reason. Oh, nawala si Ate Marietta. There is no reason to rush. So, Dr. Campbell, I am so honored to read this amazing bio because I believe your bio alone is enough for us to be so proud to be a Filipino here in America. So for our audience who are not familiar yet with Dr. Campbell, I just wanted to read and recognize his great accomplishment. Dr. Campbell is born and raised in the Philippines from the province of Bohol, and he earned his medical degree at the University of Santo Tomas, Manila, and we're bringing back Ate Marietta Stites right now, and he is a graduate also. He completed his psychiatry residency with psychoanalytic training at the New York Medical College, Valhalla, Westchester County in New York. Taga New York din siya, Dr. Ria, parang ikaw.
Oh, I heard it.
Has more than 50 years of both public and private clinical psychiatric practice and was in the care of persons with sexual dysfunction, gender dysphoria, relationship distress with spouse or intimate partners, disruption of family by separation or divorce, substance-related and addiction disorder, and neurocognitive disorder due to Alzheimer's disease and acculturation difficulty. And not only that, he is a distinguished Life Fellow and American Psychiatric Association and boarded in psychiatry as well as administrative psychiatry. He was also a board examiner for the American Psychiatric Association and had been the chief of psychiatric services at the Divine Providence Hospital in Williamsport, Pennsylvania, and the place where I work right now at County Hayden Veterans Medical Center in Phoenix, and was the chief of staff at the VA Hospital in Canandaigua, New York, Louisiana, and chief medical officer at Maricopa Integrated Health System in Phoenix, Arizona. He is also a retired colonel of the Medical Service Corps, U.S. Air Force Reserve, where he served as a flight surgeon and group medical commander. a recipient of various military awards with his distinguished military service, and lectured extensively in many places. And also, in talking about his community involvement, he is very active in our community and a true pride of the Filipinos here in Arizona because he held so many various leadership and executive positions both in medical and civic organization. He was twice elected as the president of the Arizona Psychiatric Society, president of the Philippine Psychiatrists in America, and the National Association of Veterans Affairs Chief of Staff, and a member of the Arizona Board of Medical Examiner, chairman of Council of Filipino Organizations in Arizona, chairman of Bohol Association in Arizona, and members of the board of directors of the Arizona Asian American Association. Also, a commissioner of the city of Scottsdale here in Arizona, and a former member and chair of the Human Relations Commission, where he served 6 years and is now a member of the Human Services Commission. He is the he was the past commander of the Arizona Knights of Rizal in Phoenix and now the chair of Arizona Knights of Rizal Scholarship Grant Committee and a fourth degree member of the Knights of Columbus. What an accomplishment,
My
Dr.
goodness.
Campbell. And at this time, he finally retired in 2019 from his medical,
Wow.
but he never retired in his public service. That's why I call Dr. Campbell a true pillar of Filipinos here in America, a true pride to all of us, and with his fatherly heart. We are so grateful, Dr. Campbell, and honored to have you with us as we talk about this impact of pandemic on mental health. You are the one who are truly qualified to talk to us on this matter. Please welcome Dr. Campbell.
Yay, Dr. Campbell.
Thank you, Ria, for introducing me to Dr. Campbell. Good evening. Good evening, everyone.
Good
Again,
evening po.
thank you, Ria, and greetings to my fellow panelists, Dr. Ria Flores and Marietta Stites,
Yes,
who has just recently retired from outstanding nursing services from the
yes.
VA Charlotte Head.
It's
And I wish to welcome to all our virtual new friends. Thank you for attending tonight, and I hope that this will not be a waste of your time, that you will learn something from all of us and perhaps help those who need help and all your loved ones included. So, with that,
Doc,
I will to
Dr.
continue.
Campbell, may I just interrupt you for a 1 second because I just need to highlight to our audience and recognize them. We are actually live broadcasting on two venues, on YouTube and on Facebook of Buhay Buhay sa America. So we're simultaneously live, and all our brothers and sisters are all excited to listen to you all the way in YouTube. All so many people are already excited to meet you, and I'm just going to click and letting you know that they are excited and very much proud of who you are at this time in uh, talking to us. So keep talking, Dr. Campbell. Sorry po.
It's all right. You can do it. You can interrupt anytime.
Thank you
Okay.
po.
Now, let me just state at the very beginning that we are talking about mental health and mental illness. All
Yes,
right. In this evening, I will cover basically mental illness and mental health and not cover uh, the medical, physical aspects of the pandemic, so that because most of us by this time should know what are the medical symptoms and diagnosis and testing that will come with the diagnosis of the pandemic. So I will only elaborate again on mental aspect or mental health aspect of the pandemic. Just quickly, let me give you six influences on our mental health, which would be stable, or mental illness, which would be unstable. Namely, the six influences on, on our behavior and emotion are one, the life experiences. Our life experiences, especially at the formative age, and most of us have gone beyond that, or uh, any life experiences during adulthood that is due to stress, trauma related disorder like post traumatic stress disorder. So that is one. Two is genetic. Genetics is what we get from our father, mother, grandparents, if they are ours. All right, that's genetics. And then the third influence of mental health and mental illness is illnesses, the diseases that we get through. The fourth is use of drugs and alcohol.
Mhm.
The fifth is number of friends we have, either no friends, few friends, normal number, or overwhelming friends. And the last is loneliness and association. You can think about that as we go on. So again, the influences for mental health and mental illness are life experiences, genetics, illness, use of drugs and alcohol, friends, and loneliness and isolation.
Mhm.
I bring that about because from those six, five, four or five of that are already brought about by the pandemic that we are having.
Yeah.
So that is relevant because as I discuss this, you will see that physical illness conditions of the pandemic goes hand in hand with increase in mental health illness. In fact, that's true for other illness too. People who have comorbidity, who have physical illness, die with mental health illness, die sure earlier than those who are healthy.
Yeah.
And unfortunately, men die earlier, like 5 to 10 years earlier than women. So, what can I say? Congratulations, ladies. At any rate, when I talk about the pandemic issues, I I will I will touch on the important aspects only. We will leave the minutia some other time, or that perhaps can be brought out in the question and answer. So, so to start, as I told you, those six influences of our emotion and behavior are results in three effects: positive effect, neutral, or negative. Okay. Tonight we will talk a lot about the negative effects, meaning illness. But there is a light at the end of the tunnel for a few of us. That is the positive aspect of having an illness like the pandemic illness. Okay, so what are they? Let me see. One is uh, the The effect could be positive in terms. Let me give you an example of a positive experience that I have. Before the pandemic, I used to go every 6 days, except Sunday, to the gym, and my wife also 6 days to walk around 25 minutes to an hour. Then, because my gym closed, I joined my wife walking, and I found out that I like her company.
Oh. You just start up now?
Hey, that's irregularity. Just, but anyway, I enjoyed walking with her, and that I promised without coercion that I will continue walking with her every time and then go to the gym afterwards.
Oh,
So
that's sweet.
it's good for for our relationship, and it's good for my health. See,
Yes,
so these are positive things.
Yes.
Some
true.
some of the positive things are some people are have found employment in spite of the pandemic. Some people make a lot of savings
Oh,
in
yeah.
spite of the pandemic.
That's,
I,
That's what I was talking about there.
I have stopped going to Starbucks, and that's a lot. So anyway, I'm talking about the positive aspects of this. There are people who increase uh, the exercise,
mm-hmm.
the and religion is very important. Some
Yes.
people have returned to the religious
Sure.
practice that they have forgotten. And remember, prayers to those who believe, or yoga to those who are different, or meditation for some, are a wonderful effect
Uh-huh.
on your personality, and it decreases your illness.
Mm-hmm.
So these are people who respond positively. And of course, we have people who are neutral, very few in the pandemic again. Neutral meaning they're neither happy nor sad. Life goes on with it. And then we will talk about the
Okay.
pandemic now, and then we will expand on that uh, more. So again, let me remind you that these symptoms that I'm talking in general are exponentially progressive.
Sandali lang, Doc. I think meron tayong static. If we just may static na sound.
Oh,
Okay lang. Okay
I,
lang?
I didn't hear any. It
Oh, okay.
was good.
Baka nasa akin ang static na yon. But continue, Dr. Campbell. Just in one interruption, Dr. Campbell, I just wanted to give our audience an
Yes.
idea. Uh, this is our conversation on the topic of impact of pandemic on mental health. This is not uh, something that should add depression and anxiety to you. Our hope in this broadcast is this would give you hope, because through this, when we talk about and highlight this mental health issues, we can find hope and we can find meaning in how we can cope with this situation during this pandemic. That's why Dr. Campbell is giving us this talk. So continue, Dr. Campbell. Thank you po. I'm sorry for the interruption.
No, it's fine. Okay. So again, the different symptoms are increasingly worse as we get older. In fact, that is true with mortality. You know, below 50, there are very few deaths. And when you get to 65, and to 80 and 85, the deaths increases as well as mental health symptoms. All right. So what are the symptoms that we are looking for of mental health issues related to the pandemic? Before I continue, I want to stop here and talk about stigma.
Okay.
Yes, that's a
Stigma.
very important topic, Doc.
Thank you kindly. Because the stigma is present all over,
Mm-hmm.
and it it is a false or belief that are either religious, cultural, or lack of education. And I think we as Filipinos can understand the stigma associated with mental illness.
Mm-hmm.
I
Yes,
when I was a consultant and still am a consultant with the refugees coming from Asia, younger generations bring their parents to me who are obviously schizophrenic or depressed, that can be treated, but there is no way the elder generation will accept the
Uh-huh.
treatment because
Mm-hmm.
one is either due to their sins or transgression that God is punishing them, that that really it is not acceptable to say my son or my father is sick with mental illness because we are not crazy. You
Yeah.
know,
Mm-hmm.
the craziness belongs to the other family next door, not mine. All right. So there is a stigma that is true, by the way, all over the United States. Stigma is still high and an impediment to mental health care,
Yeah.
but more so in Asians and the indigenous uh, population in the United States. So we can talk about that in during questions and answer, but I would address that because it's an impediment. All right. Now, what are the signs and symptoms? They are fear, anxiety, depression, increased use of drugs and alcohol, in suicidal thoughts, an tremendous increase of suicide, especially among the younger adults, and then also aggressive behavior. Aggressive behavior in terms of domestic violence, child abuse, or abuse to partners. Then we look for what happened when we are in lockdown or in isolation or lack of social contact. That is, there is loneliness and depression that goes with that. So, and the worst of them all in this is the economic results of people who are sick with the pandemic. The unemployment, the loss of savings is tremendous that it can influence their depression, their anxiety, their use of drugs and alcohol, and also suicidal thoughts. All right. So let me go to now. We're more than halfway over. Let me just go quickly to highlight the symptoms among different ages. From age 3 to 4 and down, usually there is amnesia when you get adult of what happened at that time. You won't remember it. So, then a little older, when you get to be 5 to 11, 12, what they will remember is what they were subjected to by the people who take care of them or their caregivers. They will not remember the viral infection, but they will remember that you were wearing a mask, we cannot go out, we cannot visit, and then the emotional stability of the family is important. If it is disrupted, that will carry on for the rest of their lives. All right, so that's uh, that's the younger generation. Then to the to the ages 17, 18 to 30, 35 is another story because all the other symptoms of anxiety, depression are present, but they have an added difficulty in terms of social contact, in terms of isolation, and in terms of availability and increasing use of drugs and alcohol. In fact, it is at this age that we have the highest rate of suicide. Women usually entertain the idea of suicide, but it is men that commit more suicide. So again, that's the second time I say I am sorry for us men, but that's the way it goes. That's statistics, and that's true. And then in here we have also younger men at this age are participating in reckless behaviors and behavior that may be adventurous or against the law. If you see the riots these days, you will see these age are preponderant, and and so that that is where it is. And lastly, on this, I'll talk to you about ethnicity. Ethnicity. All right. Just quickly, the number one illness causing death and illness among all ethnicity, number one are the blacks. That's like 87%. The second are the indigenous uh, populations. Then the third is the Asian Pacific Islanders. And you can see their obesity and things of the like that is related to this and the use of drugs and alcohol. And then next is are the whites, and last are the Asians. So in ethnicity again, let me uh, say that number one are the blacks, number two is Native Americans, number three are Pacific Islanders, number four are Latinos, um, number five are white Americans, and last are Asians. Did you want to say something, Ria? I love you too. Okay. Okay. So those are the and especially those who are unemployed. And then remember the place that they are, whether they are rural or urban, whether they are in the nursing home, they could not be visited, or they are with strong social support. So these are and the number of friends that they have. These are some of the things that can happen, especially in the elderly. Elderly is 60 and above. I'm way past that, but that's all right. Uh, the age, the as I told you earlier, the 60 and above has the highest mortality. And as you get older, the higher the mortality. And that is true with mental conditions too. And the lower your age, the less likely you will die or develop mental illness. So the morbidity is related, comorbidity is related to the death. What are the comorbid illnesses? We all know hypertension, diabetes, obesity, heart condition. If you have this at any age, your chances of dying and getting sick with the pandemic associated with mental illness is high. So, with that, however, again, I want to let you to share this with our audience that actually the actual death of the pandemic is not that high. Now, some of you might ask, what is the statistics? You tell me, because I have reviewed this and nobody can really tell with some definite answer how many are really dead with the pandemic, how many are dead with the comorbidity and they just happen to have a pandemic, and how many are dead because of both. They cannot come up, except the idea that the older you get, you will pass away. So, with that, I have exhausted my time. I wish to all of you and our new friends, virtual friends, to stay healthy, keep safe, and keep your loved ones safe. Thank you.
Okay.
I I have to unmute because earlier there was some static. And thanks to Santi Melchor for pointing out. So he sent me a message to mute us, so then there will be no other sound except Dr. Campbell. So thank you so much, Santi Melchor, for giving that reminder to us. And thank you, Dr. Campbell, for that wonderful presentation. In that short span, you were able to share with us the impact of this
Mhm.
pandemic to mental
Yeah.
health from childhood to elderly. And we truly are grateful for this opportunity to hear it right from you, the really the best source we can have here in Arizona. And
Thank you.
I hope that our audience have some questions. If you have any question, you can actually ask them. We have Ate Marietta, who is very much responsible for making this episode. Actually, she is the one who pushed us. Let's have Dr. Campbell talk to us about this pandemic impact on mental health. So, Ate Marietta, thank you so much for making this possible. And hello, Ate Marietta. Oh, naka-unmute pa rin siya pala. Can you hear us?
Tita Mayats, you can talk.
It's safe now to talk.
Okay,
Can you hear us?
talk. Or nothing.
We cannot hear you. Ate Marietta is in California right now, and we thank you for making this possible. She was the one helping me organize this, and together with Dr. Ria Flores Tamayo, who is a retired dentist. Imagine that. Dr. Ria, at her young age, retired from dentistry and decided to help mental health
Yes.
patient at this time. So,
Yeah.
Dr. Ria, what is our takeaway on this Dr. Campbell's very concise
Yeah.
and important message to all of us?
First
By
of all,
the
I would like to thank Dr. Campbell. He is a very good educator. This is my first time to see him
Mhm.
and to hear him talk. I even took notes. It's so important to me to know that. And he is my inspiration now because
Yes.
I don't hear this close. So thank you so much, Dr. Campbell, for inspiring me more. I actually was practicing dentistry a year ago. I stopped and I went into counseling because during my my dentistry practice, I have met a lot of people who are in the I would not say spectrum, but on that area, on this area, the mental health area, and I feel that I can help them because I want them to make whole again. I want them to be whole again. And because of this pandemic that's happening right now, I think a lot of us are being called to help these people. And it's really not easy. You have to have a genuine heart to practice psychology, psychiatry, counseling. You have to be very accepting. The empathy should be there because that is the reason why they are staying away from us. I'm saying us now, even if I'm not done yet with my schooling, because it's you can tell even within our own the Asian people, sometimes they would just, and I think I the reason that there is more there's not a lot of consultation with doctors when it comes to psychiatry is because, especially for Filipinos, is because we have family support. Family support is very, very strong, and it helps the person so much that the suicidal ideation is lessened. And it's true, Dr. Campbell said more of it is coming from women, but who executes this are the men. Maybe because men don't talk much, and we women we are like talking, 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 and especially with children too. Sometimes children will tell us something, but it's sad to say that being their parents, we we set them aside, we put them at the back burner, believing in ourselves, denying that there is something wrong when they are really shouting for help. So I see a lot of our friends here and they're asking also, thank you so much for viewing us. But if this is happening in your household, listen to your children. This is not the pandemic that's happening now, Doctor. I agree so much with Dr. Campbell. It's not the pandemic that they will remember. It's the time that they were with their family, when they were in the house during quarantine, what they were doing, what they were sharing. And it's true, it's not all negative. A lot of positive things happen. We we start meeting our other halves again, like Dr. Campbell said, walking along with his wife, he found out that, oh, it's more exciting now. So it is really, really good.
Thank you, Dr. Ria. And we have to mention, by the way, Dr. Campbell and his wonderful, beautiful wife, Mrs. Florita Campbell, uh, is they've been married for so long that we have recognized them as our
Yeah.
first anniversary outstanding and longest married couple in Arizona. So, by the way po, nakalimutan ko yung idagdag, Dr. Campbell. And I
Okay.
remember, sabi ni Dr. Campbell, they had for eternity to perfect their love for each other.
I'm still a project after 55 years of marriage. So
But
I think I think Tita Marietta has a question for Dr. Campbell. Tita Mariette?
do you have a question?
Yeah, thank you again for having me here. And thank you, Dr. Campbell, Dr. Ria, and Ria. You guys are all so wonderful. So my question is this, what I'm seeing from a nurse perspective is that, like, for instance, California, we have, well, in the nation, we have 1% of the population is being Filipinos, but yet the caregivers are 4%. That's a huge impact on, with the pandemic, with the effects with the family, with everything. So I wonder, what avenues other than, because some of them are not that savvy of going to somebody that they don't know. What do they do, Dr. Campbell or Dr. Does anyone have a suggestion?
You're
After
breaking.
you, Ria, go
Caregivers
ahead. Ria, go ahead. Dr. Ria,
are
go
may
ahead.
have
Ate Marietta, you're
You're
breaking.
breaking, ate. The
Okay.
the the sound is breaking. So maybe if you can uh we if we can wait one more time, try to
I
get the
But
sound audio.
I think Dr. Campbell got her question.
Yeah, I got her question.
Okay.
Okay. I'm
Meron
glad
tayong
you
commercial.
Mhm.
I
Okay,
am
Doc.
glad I'm glad you brought that about Marietta because as far as case workers and healthcare providers, there is a preponderance of physicians and nurses and healthcare givers. In fact, among the Asians, these healthcare givers have the highest rate of illness and stress and highest rate of worry
Mhm.
about what will happen to them. And fortunately, these folks are very dedicated and continue to work in spite of their danger. And there is really at this time no valid statistics to, to say how many of our Asian caregivers and nurses are uh, are having the illness or have died. These are all at this time just anecdotal. But you can understand that if you come to Arizona and especially California, you will have a lot of our care providers that are uh, Asians. And there's another important thing I
Mhm.
failed to talk. It is the unpaid health adult healthcare providers have also a high rate of illness. Unpaid healthcare providers. That means our lolas or lolos, and our relatives who are
Yeah.
helping take care of those who are sick are also sick themselves or a high ratio of stress and depression.
Yeah.
Thank you.
It's
Doc,
so sad. It's a good thing to hear, Dr. Campbell. It gives us a more deeper understanding on what we should do to really protect ourselves and the people that we care about. And in fact, today, if I'm not mistaken, in Business Insider, they just mentioned that 4% of nurses in the USA are actually Filipinos, and 35% of the death are actually these Filipino nurses.
oh,
And
wow.
so this is a very revealing how important are the Filipinos in American healthcare.
Mhm.
And yet, this tayo yung pinakamaraming death. So that's another thing to consider. And I can relate to what you said, especially Ate Marieta's talking about in California, because my brother is working in the nursing home, and I work in healthcare, and I could not see my mom because my sister is afraid that if I see my mom, who is now 86 years old, and I am always in contact with patients who may be positive for COVID. That's why my sister says no. You can't see mom at this time to protect her, and so that's something that um, many families are actually getting longer separation because of this pandemic. And thank you so much, Dr. Campbell, for answering that question. Pero meron po akong hawak-hawak. meron akong, we have a gift to all our audience. This gift is actually from Coach Koy Banal and his wife, Alma Salvador Banal. This is a, a beautiful backpack that we are giving away Two, if you are an Arizona resident, you may get this as a prize. You are the last to comment. And if you are in the Philippines, it's a 100 peso load for your phone. So, yun po ang ating prize tonight.
Ria, would you want to mention also how they can connect with us
Oh,
through
yes.
FaceTime?
Thank you so much, Dr. Ria. Another good idea to share. We are actually live, as I said, broadcasting live through Facebook, Buhay Buhay sa Amerika page, and also to YouTube channel of Buhay Buhay sa Amerika, which is now Life Life in America. YouTube suddenly changed it to Life Life in America, which is Buhay Buhay sa Amerika. And so whoever commented last gets this beautiful backpack courtesy of Coach Koy Banal and his wife. And this is really pretty. So ito po ano, give giveaway coming from our community to support Buhay Buhay sa Amerika. So
Thank
thank you so much, Coach Koy Banal and Madam Alma Salvador Banal, who actually celebrated their anniversary, Dr. Campbell, wedding anniversary, just like you, been married for a long time, but the two are still lovebirds, very young lovebirds.
It's actually our anniversary today, 24th year.
Wow.
So please greet Dr. Ria, happy anniversary as well.
I just mentioned it. But
That must be the radiance that are showing, huh? Congratulations.
thank you, Dr. Campbell. Anyways, I'll go back to our topic, okay? I have a question, Dr. Campbell. What are the coping mechanisms and how is resilience learned during this frustrating time?
Okay, good question. Uh, release. Let me tell you that all of these coping skills are either learned early or we learn from our family, we learn from our friends, and they are and the emotional stability of the person is stable, strongly positive in overcoming stresses. That stresses is not considered an obstacle, but a challenge to be overcome. So these are either ingrained in you because you can see people who are emotionally strong, stable, and they can overcome and think on their feet on what to do. They are able to get social support from their family. They know where to get social and mental health care. And usually, my advice when it comes to mental health care is talk to your primary care physicians first, and and if there is none, go to your closest closest friend whom you think are knowledgeable. Don't ask anybody, just anybody about what to do because then you will have 1,000 advices. But get from someone who is knowledgeable, from a priest or from the school counselor. Those are way of coping, and the best part of this is keeping yourself healthy because you think about the comorbidity, the obesity, the high blood pressure, and heart conditions. These can be uh, alleviated by good habits as well as diet. And then get a good support system in terms of family and friends. Do away with people who are bothering you a lot because that would not be good for your coping skills. So these are some of the uh, coping skills. Like and again, religion, exercise, yoga, if you wish. Walking is very good because these things increase the serotonin in your body,
Yes.
increase your ability to respond positively.
Uh-huh.
So I hope I have answered very little of your question, but
Oh,
that's I think what I my answer is.
And thank our audience who are actually giving their gratitude to you for such beautiful presentation. One of them is Random Adventure PH, all the way from Bulacan, May Kawayan, Bulacan. And he was mentioning earlier how grateful he is for your comprehensive presentation, and they learned so much from you. But he has to go because he got to go to work, and he's inviting many of our audience from YouTube that he has a premiere tomorrow at 10:15 a.m. Philippine time. So, yan. Si Random Adventure PH at si Boholano, Ira Boholano USA is also having her birthday today in the Philippines. So, Ira,
Hey,
kilala mo to,
happy
Dr. Campbell.
birthday!
She is also
kamag-anak.
She's also from Bohol. And since we're talking and greeting our friends, I want to greet my cousin, my very good friend, Met. Happy birthday, Met, all the way from Philippines. I love you. She's my cousin na malapit kaming dalawa. Magkasama kami ng edad. And
Oh,
so, thank you so much, Dr. Campbell. Sabi niya, maraming nagtatanong at ang mga, we have so many from Team Hope. All the Team Hope and Team Kasolid andito na at sinundan ako. They are all supporting, especially ang ating very supportive President, President Alvin Silva of our
yay!
Alvin
Hi,
Silva is
Alvin. Thank you,
Alvin
Alvin.
Silva is now has become the president of Arizona YouTubers Group, Dr. Campbell. Meron na ngayong YouTubers group ang Arizona. And Alvin Silva is the man, and he even sent his whole alagad, pati na ang kanyang mga beauty queens ng Gay 2020 of in YouTube are here watching all of us. Pati pustiso ni Dr. Strange.
Oh my goodness.
Sana si pustiso ni Dr. Strange. And she is also a dentist, Dr. Ria. And we
Uh-huh.
look forward that one day, tayo ni Dr. Pustiso ni Dr.
Strange.
Strange, at saka ikaw, at saka si Dr. Pam Sapanta will make an episode. Sabi, meron na akong title, I Can't Smile Without You.
I will always smile. And then there's another one. I think it's Geo Prem Channel, it says, or
Yes,
Chanel. I think she was asking Dr. Campbell of Rizal. So it
yes,
is, right?
yes. The
Yeah.
Knights of Rizal is Dr.
Yeah.
Campbell himself.
So, yeah. So I think they're just confirming. So,
Yes.
yes, Dr. Campbell of
May
Rizal.
nag may nagtanong pa kanina eh. Hindi ko makuha yung nakita mo ba 'yon, Doc? Tinatanong niya sino ang mas may chance ang magkaroon ng virus.
Yes, yeah. Opo.
Did
I
did you
did.
see that one? Oh,
Yeah,
which is more prone to virus, he said.
yeah.
Henry Joey Esperilla. Question: which is more prone to virus? I don't know whether he's asking men or women, but men.
Let,
Men again.
let, let me respond to that. I don't know whether he's asking about prone to virus diseases or to the virus. But people, everybody can uh, have the same affinity or chances of being exposed to the virus. But not everybody gets sick from the virus. It is, and especially those who have vaccinations of some other virus, not just this, will likely not be sick seriously if they do. So those people who will really get sick, if that is the question, who is more prone to the illness secondary to the virus, we have discussed that already. It's the
Hypertension.
elderly, those who have comorbidity, again, obesity, hypertension, and,
Diabetes.
and those who are not using mitigating activities like mask, hand washing, or uh, locking down and secluding themselves.
Okay.
Those are the people. Of course, there are side effects of all of those, but to answer that question, that is the best way I can respond.
That's very true, Dr. Campbell. And isa pa, I remember Thomas Sagayo is one of our audience here, and he mentioned last time about the importance of being positive. Kasi when we become negative, we absorb all the negativities. Our body and our immune system are goes down. So kagaya ni Dr. Campbell at saka ni Dr. Ria at saka ni Ate Marietta Stites na laging nakatawa, the virus will repel kasi hindi kayo pwedeng tamaan dahil very positive kayo. Kaya isang bagay yun.
Tatakbo ako.
It's important to have a good positive attitude at important, tama ka Dr. Campbell, tama po kayo when you say about hand washing because sa awa po ng Diyos ay yun ang pinaka effective kong experience working in emergency room. In fact, in my own work, we have so many coworkers who had been exposed with pandemic, with this virus, and many of them got sick. Sa awa po ng Diyos, ay sana po ay wag naman. Ang my only protection was that mask and hand washing. Napakalaking bagay.
Let me add social distancing, okay?
Yes,
Social distancing is important.
that's true, Doc.
That's,
Yes, Dr. Ria.
Another question, sorry, Dr. Campbell. I have a lot of questions from people, but um, are Asians generally blamed for this pandemic? We have seen bullying on both children and adults due to this pandemic. What can be done to avoid or to handle the situation?
come again, your first sentence, I did not get it. Are what?
Asians
Asian.
are generally blamed for this pandemic.
What is generally blamed? I'm sorry, I didn't get that.
The Asians.
Oh, the
Asians,
Asians. The
yes.
Asians. Oh, okay. Yeah. I my experience to that is this is true when we are talking about bullying. Uh, but there are other ethnicities that feel likewise. In fact, if statistics will show that we Filipinos are more integrated, more educated, and has the financial means truly that we are less bullied than the other ethnic minorities. But of course, it can happen on instances that there is bullying, most especially because, especially in this pandemic, it is coming from China. So, as all of us are locked with a slinky eye, even if I'm a Campbell, I have a slinky eye. I am an Asian, so Asian, China. So we get negative connotation of importing this illness here. But uh, and of course, if you are economically deprived, and some Filipinos are, like other minorities, then you don't get the care that you have. You don't have the access to private care or uh, social care. You don't know how to call health services. You don't have transportation. all of these are related. Let me stop there because I don't know if that covers the question.
Yes po, opo.
Thank you so much, Dr. Campbell. Dr. Ria, meron ka pa bang question?
Meron pa, pero let's mention, I think Dr. Campbell mentioned earlier this morning on how to get help, to seek help whenever. I think there's an
Yes.
800 number or a CDC.
It's actually right on our streaming.
Oh,
It's
okay.
the National Suicide Prevention Lifeline is 800-273-8255, and for domestic violence hotline is 1-800-799-SAFE-7233. So
Okay.
yeah, inilagay ko na lang sa streaming
Okay.
para you
Okay.
can
So,
keep on seeing it.
so people
Yes.
are asking, it's down there. It's right there, running across.
Meron pa uling nagtanong, how can I cope with depression po if maging positive ako sa COVID virus, and what advice could you give me po? Thank you po, sabi ni Henry Joey Esterilla.
Mhm.
Okay, how can you cope with depression? Uh, it okay, it depends upon how much of the depression you have, because there are mild depression, whereas there are moderate to severe. Let me say with the mild depression can be overcome without medications or perhaps intervention by a therapist. You can pray if you wish. You can exercise, improve your diet, improve your social network, and divert yourself from listening to the TV 24 hours a day with this negative news that we have. 1 hour a day in the morning and 1 hour at night is all I do, because it is depressing to hear all of these things. And you can divert your attention into reading. Crossword puzzle is good, and reading poetry, whatever suits you that you have time. Get someone to do with you, someone that you like, you know. So these are some of the things, exercise for the mild one. But for those that are increasing, meaning you're depressed, you cannot do your daily activities, or you are impeded in doing your routine work, then as a physician, my stock answer to that is talk to your primary care physician. And we have discussed that before. Talk to someone that you trust who knows, that will help you. Talk to your priest. And then you can do that. But if you become suicidal, and then or destructive and angry with the depression, you have to get professional help. And again, the process is up to you and where you go. So, and then worst comes to worst on the depression, that somebody is going to act on it, like committing suicide. 911 is the best number we have at this time. Enough said.
Okay.
Oops, I have to unmute myself again. Thank you so much, Dr. Campbell. That is very helpful. At sana Henry Joey Estrella ay nasagot ng nagustuhan mo ang sagot ni Dr. Campbell, at mayroon kang um, naiwan. Sabi ni Random Adventure PX, if someone talks of suicide, then he or she is contemplating on the idea. Yes, yes.
Well, okay, let me give it a little twist. There are some people who commit suicide acutely without planning it, who are impulsive, so either they will overdose and live and be sorry with it, or some of them die. But those who are contemplating on the idea, you can do intervention. And in fact, as we discussed, a lot of women think and contemplate of suicide, but seek help. They have friends that they talk, and they are more open to intervention by their family and friends. Whereas men, being macho, will not talk about it. They will keep it to themselves, try to help them, and if not, then they will commit suicide, usually by gun or uh, jumping from somewhere. Whereas women, if they commit suicide, is usually by overdose. But then suicide is usually associated also with alcohol abuse and depression. I hope that answers the question, and you can follow it up if you want.
Yes, and tama po, Dr. Campbell. And most of the time, women actually, even they thought about it. Somehow, they think of their children first, so they will not think. They will have a second thought.
True,
uh,
true, true.
so isang yung motherly heart will kick in.
Prevail.
And say, no, I have to take care of my kids, and we resort to prayer instead. But thank you so much, Dr. Campbell. That was really a good answer po. Very appreciative of that answer. Ito yung, may nagtanong naman si ano, although this is not mental health. Ang tanong ni Mindblog, my question host, how about no smell, no taste? Malala na ba yon sa, para sakit ngayon? Actually, Dr. Campbell, um,
Yeah,
pwede kong sagutin ko? O kayo
yeah. Actually, my grandson who is helping me here, at the very beginning, his only symptom is he could not taste well, he could not smell, and otherwise he was asymptomatic of any other symptoms. And of course, we had him tested, and he was positive, and he had to be quarantined for 14 days. So it is true, it can, but not all, but it's a good idea to have a test if that is the first time that happened, because you don't wait for uh, high fever, coughing, or headaches. If that is the case, now there are tests that comes back in 12 hours or the following day.
at this time at work, I work now at the Phoenix VA. That's where you worked before, where you retired. We can just have the testing in 2 hours, the max. So that's a good thing. And mind blood, in my ang malala is if meron ng shortness of breath na hindi
Okay.
nga, yun yung malala. Pero yung
Okay. I missed that in Bohol. Malala is sweetness of bread. That's true. Yeah, that too. But with test. But it
so
could be many things. But that's more malala. Huh? Okay.
yeah,
I'm ready.
malala po is like a worsening. So thank you so much, Alvin Silva. Sabi niya, please, guys, don't forget to thumbs up our host, and please po, dikit also if you haven't done so. He always have a great content and share to all of us. Thank you so much, President
Thank
Alvin
you.
Silva. Ikaw ang number one.
Thank you,
Uh,
Alvin.
thank you so much. Talagang maaasahan ang ating presidente, Alvin Silva. At sabi ni Ira Boholano, USA, Dr. Campbell, sana po we can have a gathering again for Boholanos missing home.
Yes, we have. You know that we have a Bohol. If you if you are in Arizona, we have a Bohol association in Arizona that I happened to start some years ago. We have a new chair now, but yes, we can have that. Actually, I'm pretty sure Ria would not mind uh, coordinating that for any of the organizations who want this kind of presentation. It's
Yes,
not Boholanos from all Visayans, Cebuanos. Council of Filipino Organizations, all of that are we are amenable to help.
Good idea.
Thank you so much, Dr. Campbell. We appreciate your support po to all of us here in Arizona. Talagang uh, your hindi lang fatherly, but your grandfatherly heart talaga ang nag, you glue us together. And as the Filipinos, we are so proud of you for what you have accomplished.
Yeah.
Kaya kahit mahabang mahaba yung kanyang yung kanyang biodata ay talagang dapat natin basahin dahil you are an inspiration to us, Dr. Campbell.
Parang
Well,
Ria, parang gusto ko na nga magpa-adapt eh, para maging Boholano rin ako. Kasi very, very inspiring Dr. Boholano. Dr. Campbell, really, thank you so much. I really do appreciate you. My goodness. I
If
feel like you're so dear to me already. You are so kind. You are very humble. Even you are a very smart person. My goodness. Very, very smart. Very brilliant. Very brilliant. The way that you explain, if you don't listen, then you won't get it. But you will listen because you can get the attention. I do great. So thank you so much po.
we learned so much from you, Dr. Campbell. And
okay.
actually, Dr. Ria and I were just last night we were discussing on this pandemic issue, and without even talking to Dr. Campbell. Imagine, Dr. Ria, what we were talking. Suddenly, Dr. Campbell just put that in less than 30 minutes na
Yeah.
talk. And we were talking for like 2 hours kagabi. So, Dr. Campbell, we're so glad that you came to us to share your expertise as well as I wish Ate Marietta can still get back.
Yeah. Yeah.
We miss you, Ate Marietta. Suddenly, your connection get lost. But
Yeah.
if you are still able to come and get back with us here, would love to have you. Yes, Dr. Campbell, Dr. Ria.
I think we're running out of time, but would you kindly mention about the Filipino National Historic?
Oh
No,
yes,
yeah.
Ate Marietta is actually the secretary of the Filipino American National Historical Society, which is remember Lani Reliamas Patubo?
Yes,
That's
yes.
his passion on how to bring the stories of the early Filipinos and pioneers here in America. So they are now our considered Filipino American heroes. You know, these people, just like Dr. Campbell. Yes, Doc.
Yes, in regards to that, the funds, Arizona National Historical Society is uh, distributing to the Filipino community in Arizona a survey on what are the effects, who are affected, and what they are doing on the among the Filipinos in terms of the pandemic. So there is a survey that will come out at the end of the month. We are taking time on that because the pandemic is still going on. We want to get a more complete response in terms of how old, what their work, complications, and treatment that they receive. So that is a project of the Filipino American National Historical Society that will be distributed through the Council of Filipino Organization.
Okay.
We That was really nice of you to mention that, and thank you so much. You are very much involved on the fans as we were mentioning, Dr. Ria, the Filipino American History Month. It's
Okay.
no longer the Filipino American Heritage Month, but this time it's even deeper because we talk about the history and what the contribution of our early pioneers. and recognizing the value of the Filipinos contribution here in America. And Ate Marietta, siya yung sweet rice bowl. Sabi
Oh,
niya, her phone
okay.
died and I'm on the line. Ate Marietta, are you still on the line? Oh, ay. So dito pa si Ate Marietta.
Ah,
Ate,
okay.
Ate,
But you won't be able to see me. It's really hard. So
come back. Try to come back.
I know.
Well, my
Oh,
phone.
Ate Marietta is ayan oh.
Maybe she can still talk. Yeah, put it on speaker, Ria, and then she can
Yes.
talk. Oh, there she goes.
Ate Marietta, you can actually tell us uh, eh, other things you wanted to share.
Well, I think pretty much Dr. Campbell and the questions that were asked by Dr. Ria and you they were just wonderful. Thank you again, Dr. Campbell, for bringing up because it really believe that mental health within our society and our community is really important. So it's just I just feel like we're with as many caregivers there are in that are Filipinos. I mean, the it's just hard to phantom the impact on one community that is.
And Ate Marietta, you were mentioning about the importance of removing the stigma. When we were talking, you wanted to make sure that we mention again and again the removing the stigma on mental health because that's a very important issue. And I'm glad Dr. Campbell has actually spoke about that as well. I know that you are passionate about this issue, and we appreciate you, Ate Marietta, for really bringing this story to us. And if not because of Ate Marietta, this topic on the impact of pandemic will probably be not shown. Ate, nasan ka na?
Right, I see her.
So,
Okay, so we're getting busy.
I think she said, "I'm getting dizzy."
We're all going all over the place. So I apologize for my malfunction. Too bad Alvin is not here, so
yes, I wish Alvin is here that he can help us fix this. You know, Alvin Silva is our tech guy, a DJ, and but I'm so glad, Ate Marietta, you were able to share with us this very important issue on um, mental health and the
yeah,
pandemic's
thank you.
impact on mental health. It is through you
Yeah.
that we get this broadcast right now.
Because, when I was talking, let me share something with you. And I was talking to my niece, very
Yes,
young,
yes.
she attended ASU. And she felt that the college students didn't have any chance at all, when it comes to being understood. There was a study that I have read, because it stems from a lot of from colonialism and the feeling of not being connected, and also the feeling of being, who do they talk to, their parents or whoever. So my niece just felt really disconnected with getting help for mental health. You know, many of them don't have insurance. They didn't even get the stimulus. If you're a college student, they be, oops.
I got it. We're okay with you, ate. You're okay. Nawala ka. That you turn off your phone. But that is actually what she's sharing is very important at this time, especially now the college students are becoming the target that the community keeps saying they're the one who is becoming the carrier because most of the college student goes out and party And that's one thing that I think not only they don't get the enough help or treatment, but also they're when you were talking about bullying, Dr. Ria, they're sorry, she's Ate Marietta, you can call me back. So, Dr. Campbell, meron po pa kayong maidadagdag, Dr. Ria? Hello? Oh, sorry, Dr. Ria. Dr. Ria?
Oh, yeah. I hope there'll be a next time with us again, with Dr. Campbell again. I learned so much. I know that all our viewers learned a lot. I really did learn a lot. And I hope that people who know that they need help, please seek help. There's nothing wrong with it. There is always privacy. There is always privacy, and care doctors, they don't share any information. So if you would please seek help. And again, thank you, Dr. Campbell. I hope to meet you in person.
All right. Happy anniversary.
Thank you po. Thank
Let
you,
me
thank you
ask you, Ria,
po.
this YouTube is can be accessed at any time in the future. Are
The episode? Opo. Opo.
this can be
Opo.
accessed in the future by
Opo.
other people. Okay.
Opo. Did you hear that, Ria Luz? Dr. Campbell was asking if this can be viewed over again, and I said yes.
Yes,
Where
this is actually on a live on YouTube and on Buhay Buhay sa Amerika po. And we can you can view this over and over. Go to YouTube channel and also at Buhay Buhay sa Amerika page.
Could you provide access in YouTube?
Opo. Yes.
Okay.
Access it.
Can
Opo.
you mute for a while unless you were speaking?
There's
Teka, at ang hirap nito. Ate Marietta, do you have any more things to say? Yes. Yeah, yeah. Nag-e-echo, hindi maka sorry. The echo is going to pierce people's ear.
well there
So it's a sorry that your system is not working well in California, but I just want to let you know how we appreciate you for bringing this to us because of Ate Marietta's initiative and her hard work. She was able to get Dr. Campbell to be our main speaker tonight, and I appreciate you, Ate Marietta, for this initiative. Yes.
Thank you, Tita Marietta.
Good night, ladies.
Thank
Wait
you
a
po.
And
uh,
to our audience, thank you and good night again.
Good
Dr.
night.
Campbell, we thank you for this opportunity that you gave to us. I know it's quite late for you at this time, but please give our love to our
Your
Mrs.
wife.
Rita for Campbell for graciously lending you to us at this time.
Thank you po.
Thank you so much,
Salamat po.
Dr. Campbell. And
Good night.
Bye.
God
Thank you,
bless you po.
Luz. Good night, everyone.
Wait a second, Dr. Ria. Huwag mo ka nalit. We,
That,
we have
that's
to we have to see kung sino yung nakakuha ng bag.
Okay. Bye.
Ganun pala.
Bye, Chris.
Yan, yan.
I have a,
There.
I have a flat heart. Okay.
Opo, salamat po. Thank you po.
Thank you
Alright,
so much,
bye-bye.
Dr. Campbell, and God bless you.
Good
Dr.
night.
Don't leave yet. Don't leave yet.
Okay. Okay.
If Dr. Campbell wants to leave, it's appreciative. We appreciate your coming po, Dr. Campbell, and I
Alright,
look forward to working with you in another time.
thank you.
Thank you so much po.
Yeah.
And I just need to mention Dr. Ria, mayroon tayong promise sa kanila. Candid Heart, hello, sabi ni Mary Carl Toledo. At ang mga kaibigan natin sa YouTube, nag-intay, so native, love it, sabi niya. So ito yung ating ito yung ating pabigay, Dr. Ria. Galing ito kay oo, galing pa yan kay Madam Alma of and Coach Koy Banal. Ayan. Hello, buhay-buhay sa Amerika, Ria Luz and Dr. Ria, sabi ng, I think si Marina from Chicago yan. Sa natin sa Buhay-Buhay sa Amerika Committee. At si Heidi Labs, thank you so much for coming. Tom Sagayo, sabi niya, thumbs up, mga mega shoutout sa inyong host at sa lahat. At si Danica Viola, thank you so much for the hearts, Danica. At Thomas Sagayo, ang ating Mr. Smile ng YouTube. At si Mindblog, ang aking kapatid from Jensen. Note Adventure, Thomas Sagayo, hello, thank you so much for joining us. At my forever talaga, sabi ni Ira Buhano. At sabi ni Marina Acevedo from Arizona, or ito si...
Thank you, Marina.
Or maybe it's Sharon Baisan, Buhay-Buhay sa Amerika, yung ating mga committee. Nag-greet sa iyo ng happy anniversary, Doc Ria and Kuya Nestor.
Thank
At
you.
birthday na niya ni Ira Boholano. Ira, keep posting para ikaw na makakuha nito, ha? the last one who posts will get this bag. And it is Philippine ang nakakuha, ang ang last na comment, we will be sending cash $100. No, not $100. 100. Wala akong pang $100, wala pa akong kinitang 100 eh. Teka, sabi ni teka sandali. Marami pa lang nag-message, hindi ko pa nakiklik. Dr. Ria, meron ka bang nakikita na kailangan basahin?
Hindi. Ira Boholano, happy birthday.
Yes.
Happy birthday. Yeah, but we're gonna have a next time. So Tita Marietta can join us.
Yes.
Again.
Teka, sorry nga, bagal akong mag-click sa, ayan. Oh,
wow.
Happy birthday, sabi ni Rain Rose kay Ira Bolano, happy birthday. Ang pustiso ni Dr. Raj, handyan pa rin siya. Great show, sabi ni, great job, Alvin. Awesome, sabi ni Sweet Rice Bowl, Ate Marietta. At sabi ni Dr. Strange. Pustiso ni Dr. Strange. At shout out to all, sabi ni Kuya Gio from Channel. At Danica, Viola, congratulations po, Sir Alvin. At the video making sure, ang ating ka-healthy Santi Melchor, that is his video about anxiety and depression, which will be perfect on this piggybacking on this topic. Ayan na, nakapasok ulit si Ate Marietta.
Thank you, Tita Marietta. Salamat po.
Nakapasok ka na, Ate. Yes! Pumasok ulit.
Yay!
Ayan, Ate. At nakapasok ka. At ayan, sabi ni Kuya Gio from Channel, happy birthday, Ira Boholano, USA. At ating si Mindblog, andyan pa rin siya, nag-iintay. Merong sabi ni Ira Boholano, Dr. Campbell, sana po may gathering sa mga Boholanos missing home. Unti-unti na nag-o-open sa atin. At oh wow, haha tita, I can out my other ninja. I haven't had smile without you. So Dr. Ria, si Dr. Strange, payag siya mag-join ng I Can't Smile Without You episode. We'll be talking about dental health naman.
Huwag pustiso, ha?
But you can smile without that.
Okay. Si
No?
Tita Marietta, maybe she wants to say something
Yes,
because
Ate Marietta, you say something.
yung about the Filipino heritage.
Yes.
I'm really proud to be part of it, the Philippine American National Historical Society, because it really brings into focus what us Filipinos have contributed here. Most people forget about the contribution that we've made in I mean, how many people have known that there was a pool hall here in Arizona that was Filipino ran,
Oh,
and
wow.
many of our migrant workers in the beginning were Filipinos. So
Mm-hmm.
there's a huge group of Filipinos here as
Tita
my
Marietta,
migrant workers.
have you met Lani po?
Yes,
Kasi
they work together.
oh,
Oh
okay.
yeah.
In fact, Lani's passion is already rubbed into Ate Marietta.
Yeah, okay. That's really good. I think
Teka,
there's a question here.
Yeah,
may,
Lani
may,
is.
may message si Postizo ni Dr. Strange. Sabi niya, is it true that blood types have something to do about who's going to get sick right away? I read somewhere that blood types A can get the virus easily compared to other blood types. Thank you, Doc, sabi ni Postizo. Unfortunately, Postizo ni Dr. Strange, umalis na si Dr. Campbell. Pero sa I don't think na
There is
nasa
not.
nasa blood type kasi type A ako eh.
Yeah, it's how you take care of yourself. It's how you observe it. Like mask, social distancing, hand washing.
Yes. Hand
Because
washing. Oh, sabi
hi.
ni Gio Pram Channel, siya si
Oh, are you Geo Pram? Okay. Hi, George.
and
Yeah,
life insurance agent here in Arizona. Yan. Yan.
I know George. Hi, George.
Yes.
Thank you
And
for your comments.
thank you so much, Kuya Gio Pram, Kuya George. At stay hydrated too, sabi niya. Virus loves dehydrated people.
Yeah.
Because when you're dehydrated,
That's right.
you can get sick easily. At si Thomas Sagayo, andyan pa rin siya.
Yeah.
Shout out to all. Ka-healthy Santi Malchor. At making sure yung channel ni Santi Melchor yan, piggybacking about anxiety and depression. Marami kayong matututunan sa kanya.
Wow.
At ayan,
That's
shout
great.
out to ka-healthy at si kapatid Tomas Sagayo and Ate Marietta is asking for help is not being weak. Tama ka, Ate Marietta. Dapat pala ikaw nagbasa niyan eh.
Oh, no, it's okay. Yeah, I mean, asking for help is not a weakness because,
Yes.
in the Filipino culture, we have what we call hiya, and you don't want to lose face, and you feel like that by saying that you're depressed, it's almost like admitting that you are weak, or so we shouldn't, think we're weak when we need help.
Yes.
And Filipinos, in my opinion, because I'm old school, we're very proud people.
Mm-hmm.
We don't want to tell people, "Oh, yeah, we need some help." I just believe the older generation, especially the elders, they don't want to go for help. My parents don't want to go for help. They don't want to say they're in their 80s. They don't want to say I have mental issues. They don't want to say that because that means weakness to them. So for the
That's
very first generation, and they're the most susceptible, sometimes they're that way, you know.
at tama ka, Ate Marietta, kasi we always portray na tayong Pilipino ay matatag, and we don't need that kind of mental health kokonti sa atin ang ano natin ng hindi tayo
Open.
pwedeng magkaroon yan. Kasi kaya natin yan. Tatawanan lang natin yan, mawawala na yung depression mo. But it's, kahit tawa ka ng tawa eh, yung pala sa loob-loob, lumuluha na, di ba? And I think, I'm glad na ipino-point out mo ito kasi especially yung pag-ask ng help is not a sign of weakness, but it is the sign na meron kang courage. Kasi talagang kailangan nating mag-ask ng
Thank
tulong.
you.
And sabi nga ni Santi Melchor, disclaimer, talk to your primary care if you are suffering from anxiety and depression.
And don't worry because we all
Thank you,
go through
Santi. I
it.
really appreciate
Yeah,
Yes.
we all go through depression, anxiety. This is so normal. This is so normal. I'm not gonna say I never had it. Never. I mean, I had the practice. I had the business to run. Oh, I'm the first one in line to go through all this.
Yes.
But
Kaya
huh?
tama ka Doc kasi walang taong immune sa
Wala,
mental.
Yeah.
wala.
Kasi it's part of ano yan eh. Physical, mental, spiritual, pagkakasama yan. Sabi nga, di ba in nursing, we learned, Ate Marietta, that homeostasis, yung health is just an equilibrium. Kailangan, parang ano yan, yung mental health, parang rubber. The more
Uh-uh.
mo ini-stress,
The one stretch.
at the end,
Yeah. It gets
mag-break man.
it
So,
gets
kailangan talaga i-reinforce ng kagaya ng mga sinabi ni Dr. Campbell. Kailangan natin ng makipag-usap tayo sa somebody na pwede nating makausap. And most
Provider.
important, mental health provider or our doctor itself. Kaya,
Yeah.
and he also mentioned positivity, just positive, smile. Well, sometimes you're in pain, you don't smile. But if you talk it over, yeah. A virtual hug. Kathy Palicano.
yes, tulungan niyo ako magbasa kasi
Hindi ko lang
mahaba.
yung YT. It says YT. I don't know what YT.
Ibig sabihin, nandyan pa rin sila.
Oh,
Watch about this anxiety. Talagang si Santi, ano yan, thank you so much, Santi Melchor,
Yeah,
for
I think
supporting us. And especially, Santi Melchor actually shared this broadcast to all his group. That's why
thank
marami tayong ka-friends na dumating na nanood ng ating video presentation today sa YouTube. In fact, we have, I think, we have how many people watching us? 16 million ang nanonood sa atin sa YouTube. That's
Wow.
and all thanks to my good brother, Santi Melchor, for helping us. Sabi ni
Tita Mayet, 16 million, hindi tayo nag-ayos. Ba yan?
16 yun.
Oh my gosh, I have no makeup.
I know.
we hope we will reach millions views. Pero 16 lang
Okay.
yun. A
Danica,
lot of learning po, sabi ni Danica Viola. Dr. Ria, Ate Mariette, can you read this?
Tita Mayet.
Ate Marietta, can you
A
read?
lot of learning po dito. Yeah, this topic helps enlighten the minds of our fellow men in fighting this battle against COVID. The cause that causes depression. Thank you so very much. Thank you, Danica Viola. Thank you.
Yes,
We appreciate it. Yeah.
that is our
You know,
hope. That
we just want to bring attention.
yes,
We need
And
to talk about it. We need to.
Yes.
Well, Rita, you talked about pandemic of mental health, right?
yes,
Earlier?
that is one. Yes, I was mentioning that we are experiencing pandemic, but because of this issue, the mental health will be the next pandemic. As if you can imagine, from from children to elderly are actually affected by this. So what I was mentioning earlier, that this is not a sign of doom and gloom, but instead we face it like there should be a solution. this conversation could be a way for us to find solution and think of the positive things that could happen or will happen if we are prepared on this issue, on this topic. We we can prevent instead of just denying that it is happening to us. Instead, acknowledging that, yes, I have an anxiety, I have a depression at this time. What can I do? Where can I get help? So many people are willing to help, and especially our access to help is available. Tama ba, Ate Marietta? And as I was telling Dr. Ria,
Yeah,
remember?
I think just I think just opening the conversation about mental health and seeking
Hmm,
help.
yes.
Talk to your provider, and if you have insurance, you can also, aside from the national helpline, like Dr. Campbell said, if it's really in dire, please call 911. It's really important. You
Yeah.
know, you're loved. Other people, I know there's people listening that feel depressed, and everyone's loved. And so the thing is to take away on this is that no one, everyone's perfect. God didn't make a mistake.
Yeah.
You know, that's how I see it.
Oh,
And
that's
So
si Danica Viola from the beauty of Hinatuan, Surigao del Sur is still watching us.
and you're
She's a
beautiful. You are
yes.
beautiful, Danica.
Sabi niya, she's a candidate for the Miss Gay 2020 YouTube edition, which is you
Wow.
have to watch Alvin Silva, who initiated this pageant, and this she's one of those finalists. So Danica, thank you so much for staying from the beauty of
wow,
Hinatuan, Surigao del Sur.
thank
Yes, ang
you.
layo na. Thank you so much, Sanika. At ayan, si Santi Melchor, kung hindi po kayo na gusto
Yeah,
niyo pang malaman ang marami, like the detail of anxiety and depression, yan ang blog na puntahan ninyo, si Santi Melchor, si Ka-Healthy, Santi
yeah.
Melchor.
Thank you, Santi.
And sabi ni Thomas Agayo, I need to talk to you,
I'll check it
Ka-Healthy.
out too.
Ayan, sabi niya, okay kapatid Thomas Agayo. At Santi Melchor, sabi niya, depression is hurt, but we need someone else to be with. Of course, primary care assistant is a must. However, through support of family and friend, that can really help. That's very true. Thank you so much, Santi. Candid Heart pala yung nagsabi niyan. At si Ella Gimayer, all the way from Nepal yan, ha?
Hi,
Ella
Ella.
Gimayer from Nepal. At Dr. Campbell, Ira Bohulano, USA, well said, Candid Heart, sabi niya. At
Ako nga, sabi ko, Dr. Buholano na eh.
Santi Melchor, sabi niya, Candid Heart, I agree with you. Family support is
Yeah,
very
family
important.
support. Yeah.
Yes. At dumating na rin ayan, nag-agree, maraming nag-agree. Si Kobayashi Shogun TV, ang aking kapatid. It's been a long time. I haven't seen you, my brother. Thank you so much for staying. Pablo, host po as Pablo. Ibig sabihin ng Pablo sa YouTube is they need some as moderator. I cannot Pablo, kapatid. It's very long, ano tawag dito, mabagal ang YouTube. YouTube is very slow at this time. Nasaan ako? Great content, sabi ni, great content talaga ito. Salamat sa lahat, sabi ni Ira Boholano, USA. Can you help me read other while I'm
Sagayo. Thanks, Doc. Thanks, Doc. Thanks, Doc. Thomas Sagayo. Thank you. Ira Boholano. Yes po. Thank you, Ira. And then Santi Melchor, watch vlog number 8, Anxiety and Depression.
Ayan, si Jan Bell, andyan din.
Tamsak. Anong tamsak?
Thumbs up is if you like you give a thumbs up. But in
Oh, thumbs
because
up.
we are Filipino YouTuber, we call it tamsak. So, yan,
Oh, Tita
yan,
Maria, marami tayong nalalaman.
yes. And
I'm
shout
very
out sa'yo, sabi ni Thomas Sagay.
Malab. Tapos kay Nay, N.
Yes. Tapos ka na.
Oh, okay.
Tagalog na. Ngayon, they shorten the
Tapos kay Nay.
and ayan, YT, nandyan pa rin si Ella Guimayer. At
Candid
Candid
Heart.
Heart.
Thank you, Doctor. Hi, Candid Heart. Salamat po,
Salamat po,
Dr.
Dr.
Campbell.
Campbell and Real Talk. Thank you so much. Ate, help me to read it. Ate
Mayra.
Oh, I turned off my mega shout out. Buhay sa America. I'm a co-host. Thank you. Salamat.
Yes, katatapos lang ni Real Talk Balao.
Excuse my Tagalog.
Yes, I forgot. I should. You're not a Tagalog speaking. Ate Marietta's been in America for so long, and her Tagalog is no longer fluent. Ayan. At good input, sabi ni Thomas Sagayo. Good input, Candid Heart. Shout out sa'yo, kapatid. Great job. Thank you so much, Candid Heart, for that message and inspiration. Ayan, meron na. Can you please read before me?
Santi, we will watch it. I will watch it.
Over 50 years in Fabulous. Many, many years ago, I lost my mother to suicide. So I'm very glad you're talking about this.
Thank you.
Yeah. Sorry, over 50 and Fabulous. I can feel your pain. It must be very hard to feel that, because suicide is actually not just the person, but the entire family still suffer and lingers for for a generation. It's a very important topic that we all can. It's hard to heal.
Yeah, but you know, over 50 and Fabulous, Fantabulous, this is the right thing for you to do. You are expressing it, you're letting it out rather than keeping it to yourself. You're sharing it because it's
Mhm.
harder to keep it to you. So this is a good thing that you're doing. Yeah. And seek get somebody, like, it's always good to talk to someone like a counselor or some friends. But this is
Yes.
so good that you're letting it out.
Yes, and we appreciate that you share that, because
Yeah.
it only shows that it is real. It can happen to anybody, and
Yeah.
such a wonderful and informative topic. Ella Gimayer says, from Nepal. Bagay sa akin yung bag host.
O ayan, i-draw mo na. I-draw mo na yan.
Sino kaya yung makakakuha nitong bag na ito?
Okay.
Vera Boholano, USA, maraming salamat po sa greetings and happy birthday sa iyo, Vera Boholano. Stay home. Kaya, ayan, stay home pa rin si Mind Vlog at si Boss Lady, Tamsak, sabi ni Boss Lady, thank you so much. Is Beth TV ba yan, Boss Lady? Yes, nakita ko na ang twin ng pinsan ko, Dr. Ria, kamukha mo, talaga pinsan ko. Aba, may kamukha ka, taga-Buholano din, taga-Buhol.
Pwede Boholano na ako.
Mega shoutout ni Ria, buhay-buhay sa Amerika, sabi ni Beth TV. Si Boss Lady pala si Beth TV. Kaya pala tawag ni Bikalkan is Boss Lady. Ayan, ayan. Mga kaibigan ko to sa YouTube. Buti naman, type A din ako. Sabi ni Ira Boholano, USA. At you got this, sabi ni Ella Boholano. At si Cathy Policarpio, all the way from New York, ha? Hindi pa natutulog yan. Thank you so much, Cathy.
Thank you,
From
Kathy. Don't go to the city.
New Jersey, thank you so
Stay away
much.
from the-
And ayan, si Boss Lady. That's what other people think
Think
also.
all of us.
That's true, ate, sabi niya. Life in Ami. That's true, ate. Oh, life in America. And call your relatives and ask them how they are doing, and then really listen. Let
Mhm.
them know you care. That
Yes.
is a
Yes.
very good um, recommendation from over 50 and Fantabulous. In fact, over 50 and Fantabulous is my super
Yeah.
chatter this morning for my live streaming. Thank you so much, over 50 and Fantabulous. And sabi ni, it's true
Thank
ate, like the
you.
American. Thank you so much, over 50 and Fantabulous. Many, many years ago, sabi nga niya, she lost her mom. And
Mm-hmm. Thank
sabi
you.
ni Juliano, deep pression. High pression na lang. Joker talaga ito. Instead of deep pression, high
Hi.
pressure. Ano rin
Yeah.
yun, mahirap.
You know, this,
Got
I
late,
know we
sabi ni.
want to make light
Oh,
of
hi, Adeline. This
depression,
is my cousin
but
Oh,
it's, it
there.
really is serious
from
stuff.
Chicago. Thank you, Adrian. We're almost done.
Yes. Thank you so
We're
much.
very excited.
Yeah, you can watch it
Adrian.
again. Sabi ni Real Talk Balao, thanks Doc. At Adeline Flores, thank you for sharing. Dr. Ria will catch up. More power to this show. Thank you so much po, Adeline Flores. At thank you po for.
That's my dear cousin.
That's nice. Nasaan ako? Please read for me.
Both my mom and dad died on the same day. Right now, my brother is suffering from kidney failure. But never pumasok sa isip ko ang ma-depress. People nowadays need some attention and love. Yeah, real talk, balaw. Balaw. Okay.
Thank you
Mm-hmm.
so much, Real Talk. Condolence sa'yo
Oh,
and
yeah.
to your family.
Yeah, condolences.
Wow. At Real Talk Balao, virtual hug, sabi ni Cathy Policarpio. At Ella Gimayer, thank you so much for still staying. And sabi ni Real Talk Balao, depression kills. Sharing with your friend can lessen your burden.
Yes.
Yes, that's
Thank
very true.
you.
Thank you so much.
I
And
saw
God,
this. I saw statistics showing God is good. Yes. Thank you.
you were saying something, Ate Marietta.
Oh, we have Filipinos watching from, well, actually from the Philippines, right? And I just saw a statistic a couple days ago that rise in suicide rates and suicide ideation has actually um, is increased by tenfold in the Philippines. So taking that into consideration, here being in the United States and being the Philippines are two different things, I think. But
Yes,
thank you for sharing, everyone.
yes. And Ella
Depression is
Guimay,
not a
yeah. And Ella Guimay is actually from Nepal, and she says, I'm very far away from my family. Only few people whom I can talk to, specifically if I have some struggle of adjustment in terms of culture, but still keep going on and praying. Oh, I know, Ella Guimay, I know how you
yeah.
feel because when we were new in America, even we all think America is the best land we can be. The first
Mm-hmm.
few
Yeah.
years we cry because we are far away from our family, and much more you are in Nepal and speaking a different language, different culture, and we
Mm-hmm.
feel. And but no, and thanks God we have YouTube, we have Facebook, we can communicate to our loved ones easily because of technology. And I hope that you will feel better and make more connection to the people in Nepal. This is one thing I learned when I moved from Philippines to Chicago. I know I have nobody, but I try to love the place. And
Mm-hmm.
when I moved here from Chicago to Arizona, 14 years of being in Chicago, coming to Arizona, I have only one thing I have done na I was able to get over with loneliness and homesickness is I felt I need to love the place. I need to invest and love the place and the community. And you know what? If you invest and love the community even more, the community will love you back. And soon you will not feel homesick anymore because the people who you are with becomes your family. That is my thing on depression and anxiety that we see. Sabi ko nga kanina on my live broadcast on when I was inviting people, I was on my plants next to my okra. If I did not plant during this pandemic, I probably will still be anxious and still be worrying. But I instead I actually channel my fear and my anxiety to something productive. That's why I planted. If you see my talbos ng kamote, my saluyot, my okra, that gave me joy. That gave me the therapy instead na matakot ako, ang nangyari, the plants are actually giving me the positive energy. So my my fear and my worries disappear because I see that there is something growing right in front of my eyes, even though in this pandemic. So maybe I invite you to use your hobby. What makes you happy? What makes you feel alive? Do that. Not by drinking alcohol or drugs, but something positive. Then that is how we can overcome also this issue of mental health. Tama ba, ate? Ayan, si Ira Bulano, ang kahuli-hulihan yatang
Yay!
ikaw ang bida, Ira. Naku, meron pang sumulot.
Ano?
Ay, thank you so much, Ella Guimar. Sorry, taga Nepal si Ella Guimar. Thank you for your wisdom of thought, ate. It really helps me a lot. Thank you so much, Ella Guimar. So, inaantay ko lang na isang taga Arizona ang sumulat. Kaya, sorry, Ella, you are way far. You're in Nepal. So, ang ating birthday celebrant, si Ira Buhulano, ang nanalo ng bag na ito. Ayan meron tayong nanalo.
Thank you, Ira. Congratulations.
And happy birthday, Ira.
And happy birthday.
Hindi pa tapos naman. Yeah, tapos na. Iniintay ko lang matapos. So we can actually close this at ikaw yung kahuli-hulihang taga Arizona na nagsulat. Kaya Ira Buhulano, USA. She's a YouTuber from Arizona. Ira, magkikita na rin tayo sa wakas through this bag. And happy birthday to you.
Happy birthday.
Yes.
Okay.
So maraming salamat. At yes,
Thank you.
happy birthday to you.
Anniversary.
Aba, may sumulat po ulit.
Happy anniversary, Dr. Ria.
And happy anniversary, Dr.
And
Ria.
Thank you po. I hope to meet at Tita Mayat soon.
And sabi ni
You
Lito
will.
Malaysia, keep inspiring others. We never
Thank
know.
you, Lito.
We never know the one who gave you smile. Needed the most. Thank you, Lito Juliano, all the way from Malaysia. Yay! Sabi ni Ira, yay, salamat po. Ira, I look forward to see you, to give you this bag para magkita tayo. Meron tayong panibagong topic sa YouTube nating video. Collab. Ayan. Sabi ni Danica says, very big help po to sa amin. So much,
I think Danica is getting the 100 peso load.
Oh.
Right?
O, sige. Meron ng 100 pesos si Danica.
I do.
Alam ko tapos na to.
I know.
Pero bakit si Dr. Dr. Ria has promised to Danica. Ayan Danica, meron kang congratulations. 100 peso load. So, connect with me and Alvin kung ano yung number mo ng phone and we can actually help send you the cash load for your phone phone yung 100 peso note. Yay! And thank you for staying.
Oh,
Yes.
Yay,
At
thank
ayan,
you.
na-meet na kita
thank
before. O sige, magkita ulit tayo.
Congratulations.
Ayan, this is a really amazing topic. God bless to everyone and keep safe and healthy po, sabi ni Ella Gimayo. And stay home, sabi ni Mind
Oh,
Vlog. At thank you so much po. And
so
as we close,
Ella,
ate,
Ella, just remember, God did not make a mistake. You were all, you know, He made us in His image. So, but thank you. So,
yes.
God never makes a mistake. We're made
Well,
in
thank
His own image. So, you're
yes,
loved,
Mhm.
Ella.
yes.
Very
And we
much.
love you all. Not
Danica,
only
thank you.
we love you all and thank you so much. At dagdagan ko po siya ng 50 hosts. Aba, galing naman eh. Ira Bula, no, nagbigay pa siya ng another 50. So maging 150 na. Ayan. Thank you so much. Please give me her number too. Oh, I don't know her number. Ayan, Danica, please write to us your number and Ira Boholano and I can uh,
Boholana, Ira Boholana.
Ira Buholana. So, thank you so much po. Ayan, pang-load na si Danica Viola from Surigao del Sur. Yes. So,
Oh,
yeah. So, thank you so much as we, ayan, magandang topic niyo host. Thank you at marami kaming natutunan. Thank you so much, Mind Vlog. And
thank
as we
you.
say
Thank you.
goodbye tonight, and
Thank you,
sabi ni
Tita
Ella
Marietta.
Gumayer, congratulations to a very successful and informative topic. So, kaway-kaway tayo dyan, Dr. Ria and Ate Marietta.
Marietta.
As we close this